Welcome everyone to today's webinar, Physician RCM During a Crisis, Key Steps You Need to Take to Avoid Huge Losses. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Julie Appleton is the Vice President of Physician Revenue Cycle for Ensemble Health Partners. Julie brings more than 20 years of healthcare experience in progressive leadership roles within a couple of the top 10 healthcare systems. Julie has spent most of her career working with providers and operations leadership by helping practices improve financial and operating performance by improving coding. She has a proven record in consolidating professional fee coding teams and guiding teams through periods of change and innovation. Her experience includes large-scale, multinational acute and physician revenue cycle operations, teaching physician hospitals, and consolidation and transformation of professional fee processes. At this time, I am pleased to turn the floor over to Julie to begin today's presentation.
Thank you, Ayla. This is Julie Appleton. Thank you for that introduction. I would also like to add that joining me on the call today to assist with Q&A is Christine Brush. She is one of our managers with Ensemble Physician Revenue Cycle Coding and Education team. She is going to assist again at the end of the call with the Q&A portion. So with that, we'll get started with the disclaimer. So of course, this guidance is as accurate as we know it to be at this time. These are the guidelines for the COVID-19 public health emergency. As I think probably everybody on this call is aware, those guidelines are changing constantly. This information is a general summary and it's not intended to take the place of either written law or regulations. So we have reviewed the statutes, the regulations, and all of the materials, but we recommend that you do that as well. So our objectives today, we're going to talk through our experience with the public health emergency and just outline what we believe our keys to success are, our internal teams and processes, talk about what we did for care teams and those processes, and our lessons learned. Of course, we all want to be like a duck, calm on the surface, but paddling frantically underneath. We all hope to look that way in our careers, and we have strived to do that in this very chaotic time. Our goal has always been and is every day to ensure that our physicians can take care of patients in any capacity with as little disruption as possible from a revenue cycle perspective. During this public health emergency, that has been our first priority, is to support our physicians. So on January 27th, 2020, the President declared a public health emergency related to COVID-19. So I certainly did not know, and I don't think any of us knew at that time how much our lives were going to change. From that day forward, things started to change slowly, but in mid-March, the pace at which we received those coding changes was very frequent. We, as Ensemble coding team, we started time stamping the updates on our guidance documents and our responses because it was changing that frequently. So we were putting not only the date, but the time of that guidance. And our coding information was changing daily. And, again, it was changing hourly on some days because we were not only dealing with the CMS guidelines, we were dealing with commercial payer rules, in addition to multiple state payer rules and regulations, and of course, across multiple healthcare clients and systems. So federal, state, and private sector rules and regulations have been reviewed and updated constantly, with our most recent major update occurring with the CMS guidance on May 1st. So there were 3 questions that we asked ourselves in our efforts to support our physicians. So the key to the support of the physicians in their health systems is to get the claims paid. The healthcare system is in crisis. We need to support our hospitals, our physicians, and all of the providers. So we were receiving hundreds of emails asking for guidance. We mapped out a plan, and we focused on the top 3 questions that we were receiving, and we began to create our support processes and materials. So, the top 3 things that we were being inundated with, the top 3 questions were, what code do I choose? What modifier and place of service do I use? And what needs to be included in my documentation? And so we took those questions and we created our process and started outlining how we could assist. And so throughout the presentation, we're going to talk about collaboration and communication because, of course, it is key to our strategy. So we quickly realized that no one team with the physician revenue cycle had enough resources to deal with this alone. So, we had to pull everybody together and collaborate. This was not just a coding problem. It was quickly evident that this was a healthcare revenue cycle problem and healthcare in general, and we needed to streamline our resources to succeed. So we capitalized on our team's strengths, and we created multiple task forces that rolled up to the leadership team. And so the task force began to map out, possible scenarios. What were the unknowns at this point? So we looked at workflow solutions for the new clinic environment. We collaborated with information technology because we were having to make system changes frequently and rapidly and to prepare for the potential outcomes. So communication was imperative because we were gathering knowledge and information was changing. So as a team, we would huddle every morning and every afternoon. There were also multiple meetings in between, of course, throughout the day, but the key was to keep everyone updated across the physician revenue cycle as well as our clients. So externally, we were communicating with the payers and other resources to navigate the changing rules as well. After a slight stumble, so it didn't go perfectly. We learned from our mistakes, as we always do, but we knew we had to have that centralized source of truth, to keep up with the constantly changing coding rules in this environment. So we could not have that communication coming from multiple places. So we created a centralized workspace with teams. We documented the decisions that we made, our thought processes, the timing, the guidance that was used, everything that was in play when we were making those decisions, because we knew we were not going to be able to remember it all. And that helped us to keep up with the ever-changing rules. Everybody could refer to that document and know, where we were at that time, why we did what we did, and where we had moved on to. So, because we needed to remember why we were on the path we were on and then why we changed course. And we had to change or revise edits multiple times, across the guidance to ensure accuracy. And we had to document every one of those steps. We also needed all coding guidance to come from one source to ensure the coding guidance was accurate and consistent. We didn't need to have a lot of people reading guidance and coming to different interpretations. So we discussed those documents, the information that was being given, and our coding team became the source of truth. Christine Brush, who's on the call, is going to help with Q&A, was one of those key resources in being the source of truth. That information had to come from one place as we were relaying that information to our clients and to our teams to ensure that we, had accurate coding. Our volumes were not the same, of course, with the COVID, with the pandemic and the impact that it had on clinical care. So we also had to reallocate our resources internally based on need. And I believe that was one of our greatest accomplishments as a team and as ensemble as a whole. So our internal teams and processes, this is where our strength came in, and we redistributed our workforce. So it takes a village. Can't do it alone. So following one of our key internal ensemble principles, your responsibility extends beyond your job description. We engaged our team to take on adjusted responsibilities to ensure all tasks were completed timely. We had team members that, did not have workflow coming in because of, the changes in clinical care. So we redistributed those resources to help out in other areas. So if you normally were performing assessments, you may be working on revising system workflows or edits based on your operational strength. So you probably became a part of that task force team. If you normally performed coding quality audits, you may be calling payers. There was no time for complacency. So we created an internal grid. It was managed by one ensemble leader, and every team across the organization listed staff members who had flexibility to assist in other areas. So we tracked their current area that they worked in, what their skills were, what systems they had access to, because of course access can delay us frequently, and when could they start helping? Was it immediate? Did they need a week's notice? When could they start helping? And we tracked areas who needed help. We matched our available staff who could help to the areas that needed assistance. So for example, coding, we ended up needing some help, and we had team members in other areas who did have coding knowledge that could help us and became available. And so we realigned them to help us on the coding team. And so we have tracked that staff throughout the process. We tracked how long it took them to get access, if they needed to add access, when did they get it, when did they start helping, and just kept track of everybody who was helping and everybody who was available. And it has proven to be a very valuable process for us as an organization. So we also, had to identify leads. Everybody can't be a chief. So we had to identify leads and the decision makers. And again, going back to that source of truth, who's going to make that decision and give that advice. So, and it was one of our early stumbles, conflicting advice, people with different interpretations, as coding rules and revenue cycle guidance can happen. So we knew at that point that we had to have leads, especially with the guidance changing so quickly. Everyone could not keep up with all of the changes. So we, again, created a central source of coding communication with Christine Brush taking the lead, and another team member, Cindy Zimmerman. And this minimized confusion and conflicting directives that had occurred originally. And after that, we did not experience that once we had that centralized source. And so we had to identify leads like that for each area. So again, coding rules and regulations. Our coding audit and education team is the source of truth on guidance, bottom line. All coding rules and regulations should be communicated by them. They are the lead. COVID system edit, we created a public healthcare emergency crisis team, and they connected with the lead IT liaisons with each of our clients so that our system changes could be implemented quickly. So we were adding edits at a rapid pace to ensure that we coded correctly and to prevent back-end denials. And so we needed that team to take the lead, and we couldn't have multiple people making changes to edit. We had to determine who will communicate changes. So with the guidance changing, we had to get the changes out. And so, of course, that varied by client based on their preference, but we worked with every client to figure out how they wanted that communication to occur and established a central communication liaison with them. And that helped minimize confusion because we did not have to interpret or recreate the communication. So we referenced the client's communication preference and process and distributed information that way. Internally, our coding education team, audit and education team, they communicated the guidance to our teams across the physician revenue cycle, and they were doing almost daily education with the coders so that the coders would be up to date and aware of all of the changes as well. So we had another major hurdle with multiple payer guidelines and multiple states and multiple systems. So based on analytics, we identified our top payers by client. We created a call tree. We divided up our teams by payers and by person. And we engaged our coding, audit, and education team, and they made phone calls to the payers. So they reached out to all of the Medicare administrative contractors that we work with, and they also reached out to all of our top payers, called them on the phone, asked questions. We researched the online published guidance by payer, and we listened to any webinars that they were having, and we compiled, our guidance information. We created a payer matrix, and we separated the grid by modality, phone, telehealth, e-visits, etc., and identified what modalities were being accepted by what payers, because not all the payers were accepting all of the modalities. And then the payers, including CMS, were changing their directives on how to code and submit modalities, like the telephone visits. And so we included all of that in our grid with the time frames of those changes related to each payer. The grid included all the references that we utilized for the payer guidance. If we talked to the payer, we documented who we talked to at the payer. If we listened to a CMS webinar and got the guidance from that webinar, we documented that in our guidance document, in our matrix. The payer webinar, listservs, wherever we got the information, we documented it and tracked it on our matrix so that we could refer back to it. So our keys to success, I think communication and collaboration, they're key. I've used those words throughout this conversation, but Teams has been a key element for us. Teams, the technology tool, it became our central communication storage so that everybody across the enterprise could reference our COVID team. We documented everything to keep everybody informed. Those were keys to success. So it wasn't just a conversation. We documented it. Everybody could go back and review the information that we referenced, the guidance that we referenced, and it helped us remember all of our steps. We've already talked about our payer matrix, but there have been a lot of moving parts to track. So again, Teams has been a great collaboration and tracking tool for us during this process. It's definitely a takeaway for us. We will use it for multiple other things going forward to ensure that we document all the things that we do this way. In Teams, we also, for the coders, we created a central education station, and we housed the ever-changing coding guidance and education for the coding team. We were doing education with the coding team almost daily, and we recorded each of those sessions for the coders as well as the external sessions that we did with our clients. and we ensured that everyone had the opportunity to listen to the session and refer back to the training. So we also created an FAQ list for our internal team, as well as sharing with our physicians and operations partners. We tracked our daily volumes. We were frequently looking at what we had to place on hold and why. If we were missing a guidance or needed an updated guidance, we did not want those to get lost in the shuffle, so we looked at those numbers daily, every day, and we're reporting out to everybody why they were on hold. If payer guidance changes, we have a list in our COVID team that tracks the project to completion to ensure all claims are corrected and or paid appropriately. So we may have a list of claims that went out with the first guidance. Say, for example, United Healthcare, we sent it out as a telephone visit, and they came back and said, I don't want a telephone visit, I want an E&M visit. And so we tracked it because now we need to ensure that it either gets resubmitted as an E&M visit, or United Healthcare is going to reprocess it for us automatically, maybe. But anyway, we kept in touch with the payers, and we're making sure that they get paid based off of the new directive by the payer. So we're keeping that tracked in teams as well. And also, you know, CMS, with their latest guidance on May 1st, they increased the payment for telephone visits. So, you know, we've already got our list, and we're going to walk through those claims and follow them through the process to ensure that we get all of those paid at the updated pricing. Some of our processes that we did, you know, from a tracking perspective, we had a compliance process. So our company compliance versus our client compliance. But we tracked complex issues to ensure that it was communicated appropriately across all of the teams. There were some gray areas, and we discussed internally as well as with our clients, and we documented all of those decisions so that we can refer back to those. You know, we monitored our risk, even though CMS says they're not auditing. We wanted to document the decisions that we have made and why, and based off what guidance. And then we had a client-specific compliance team that we consulted on gray areas for their interpretation regarding their specific gray areas. We certainly weren't making all of the decisions for the client, so we collaborated with them, and we tracked and trended that guidance as well. Information technology has been key as a partner to have those key contacts and to escalate the edits and system changes. You know, our typical change management process from an IT perspective, it just would not work in this environment. You know, we couldn't hold claims for as long as it may normally take to make those system changes. So having them as our key business partners with our client partners was certainly key to our success in getting those edits updated and created quickly. We talked about our key team members that became the System Edit and Optimization Committee for these out-of-the-ordinary workflow changes. So, you know, it wasn't their job prior to COVID, but they quickly engaged as a team and created a very successful edit and optimization committee for us from a system perspective. We also collaborated with physician leaders with our clients. So, you know, each of our clients have physician leaders that we collaborated with. They were very collaborative in providing feedback as to what kind of education they needed, the questions that they were receiving from their peers. They also took the lead on sharing system functionality knowledge with their peers. So we would partner. We certainly wanted to talk through all the coding guidance, but they could, the physician leaders could talk through the EMR system functionality guidance from a documentation perspective. So their partnership was vital to the success of our education. Would not have been as successful without their collaboration. We also, we have an acute care team that does acute care coding here at Ensemble Health Partners. And so we work very closely with them as well. Both of our education teams worked very closely together to compile education topics and to ensure that we were providing consistent communication regarding COVID to our clients, because, of course, we both support the same clients and, again, didn't want to conflict each other on guidance. From an acute care perspective, they are one of our partners that shared resources with us. They had a little downtime and some FTEs that could help as our pro fee reviews were increasing, because we were looking at COVID encounters to assist our physicians. We didn't want them to have to remember what modifier to select. So we didn't want them to have to worry about which place of service was accurate. So we engaged our teams to look at those encounters, and we were looking at more than we normally would from that perspective to ensure that we supported the physicians and got those encounters out the door successfully. So communication, keyword, communication, communication, communication. I've said it frequently throughout this presentation, but you can't communicate enough. Our daily huddles have been an extremely valuable tool. We did huddles prior to COVID, but we have certainly upped the huddles since the COVID public health emergency. And we huddle with all staff members. It's not just a leader huddle. It is an all teams huddle. And we allow the staff to ask questions where they need clarification. We present new opportunities that may be a challenge today. We share successes with the team as we monitor the numbers, and they work hard to get claims corrected and out the door. We want them to see the fruits of their labor, so we share those successes with them. We discuss the coding changes that are occurring, clarifications. We present examples that may have come in from a client the day before. This is what we're seeing. This is what we need to do. A new system edit that was put in place yesterday afternoon. We need to make sure that everybody knows. And we also may have shared a reflection to support each other. Huddles were key, to keeping each other going and supporting each other through the crisis. We shared about denials. So certainly we worked very hard to get the claims out the door clean, still are working very hard to get them out clean. But there's always going to be a denial somewhere along the path. And so as we would see a number appear for a denial, we would share that and still do on the huddles every morning about a new denial that we're seeing and what we need to do to correct it. We share the volumes that are beginning the day so that, again, when we share it tomorrow, they will be able to see their daily progress. And we frequently have to run through what is on hold and why, and should it still be on hold, so that we can avoid those accidental releases. If our volume is growing or decreasing out of the ordinary, we engage with our PHE, our Public Health Emergency IT Task Force, the team that we created for the public health emergency, and they look at the workflow. So we certainly had days where, we're reviewing the numbers and for some reason it has spiked. So that team engages quickly and looks at all the edits that are firing, especially if we made a change the day before. Is the edit firing appropriately? Is it working as we thought it should, so that we can quickly resolve any issues with that spike? So is there anything that are going through the work queue that should not? We're doing a constant refresh of our numbers. It's key to the success, looking at the numbers and making sure that we have our eye on the number. So we created training for our clients as well as our team members. So with our clients, we did multiple training sessions a day. to ensure that we provided convenient times to physicians and to the operations team, but we certainly wanted the physicians to have the opportunity to ask questions and not just listen to a recording. So we provided multiple education sessions over the course of several weeks to ensure that physicians had opportunity to ask questions live. We made the coding education mailbox the central communication tool for answering questions for clients and our internal team, ensuring a central path for questions in addition to their client-assigned liaison. We did weekly updates with our key business partners to ensure we had appropriate focus. So we met with compliance to review the status of questions or gray areas weekly, ensuring that the questions had been answered and everybody understood the outcome. We met with the insurance team to determine if we were seeing any special payer rules changed, and so that involved client teams as well. And then we met regularly with our client leadership teams to stay engaged with feedback from the operations team. So we increased the frequency of engaging with our clients as well. So our leadership also held company meetings. So Ensemble as a company has done a great job of ensuring that we, Ensemble as a team, are connected and demonstrating the Ensemble difference that people first, last, and always. So it seems like all we've talked about over the past 8 weeks is COVID-19, and I feel sure it is because that is really all we have talked about over the past 8 weeks. We've engaged with every team and associate more than I can historically recall engaging. We stayed engaged with our clients and our physician frustration points as well. So from a care team's perspective, not all clients are the same, and they do not all have the same processes. So we certainly had to be engaged with our clients and the care teams to ensure that we were accommodating their workflows as well. They had different clinic setups and how they were processing patients, and we certainly had to have a good understanding of that knowledge in order to support our clients and their care teams successfully. So our communication tools, so we've talked about the matrix. We created the matrix for our clients, and I'm not sure if everybody is seeing what I see on my screen. It's not completely loading, but we created the matrix for our CPTs, our modifiers, our place of service. We had our EHR teams build the edits. We created that. We kept that on the matrix. And then 100% review of our telehealth services to ensure that we supported the physicians with the required documentation, and so that we could provide them feedback on what was being documented correctly or what may need to be changed. So we wanted the physicians to have comfort that we were reviewing their telehealth notes. They were stressed out enough treating patients in the COVID environment. So we wanted to make sure that we had the processes in place to comfort them. And they had to document, but we wanted to make sure that they were supported and felt supported, that we were going to correct any errors, update them on what they may need to do to change, but we were going to catch it and correct it if they chose the wrong code. For FAQs, when we were updating those, we used different methods to ensure that everybody knew that there was an update. So, we started out with red highlight, but then we moved to strike throughs so that everybody would recognize the red, because, we just didn't have enough colors in the rainbow to cover all the changes that were being made. But liaison with our clients to communicate key items through the appropriate channels. So again, that lead person who could ensure for the client that the communication was making it to the right place. So that operations lead who ensured that the physicians received the communication and that the operations team received the communication. That was key, and that was a very quick decision that we had to make and understand who that person was with the client to get that information out. We mentioned that we called the payers and kept our guidance document updated, but we also engaged with the clients to understand what communications they were receiving from the payers and what they were receiving from their managed care contacts. So all things do not fit all people, so we had to alter our course for client-specific solutions, and so we did that. We also had to partner closely with our client IT teams. They were different as well to streamline our revenue cycle workflows. They were carrying a heavy burden of updating medical record templates, smart phrases, location updates, etc. So our understanding, our support of each other was key so that we could all accomplish what our goal was, which was to support each other and to support the clinicians. And so we worked hard to ensure that we could present the workflow that we needed to the IT team so that they were not burdened with that additional step of trying to figure it out. So if we, knew the system functionality, we wanted to make it as easy for them to implement as possible because we knew that they had a heavy burden as well. We also utilized some system flags to track things when we were uncertain if it would have a downstream or long-term impact so that we could easily identify those items as they work their way through the process. And we included those things in our updates and in our FAQs and in all of our communications materials, making sure that everybody knew what those opportunities were. So guidance documents were key. So Ensemble, we created a pocket card, and we're sharing our pocket card with you, and we will make it available to you as well. But this was a key ask from our physician collaborators. They wanted a short, simple document that they could use to reference what codes they should use when, and this was our pocket card to share with them so that they had that tool to utilize. So in summary, our keys to success involve the entire team at the project onset. I'll have to say that we're still learning. Things are still changing. In my career, which has been longer than I want to admit, but I've not encountered anything quite like this. I've never encountered anything quite like this, and I hope that I do not encounter anything like this again. There's not another pandemic during my career, but if I do, I feel equipped, and I hope that we can all share and learn from this, because it does take a village, as we said in our earlier slides. But our key takeaways, our keys to success that will help us be successful ongoing in all of our endeavors are communicate frequently with the entire team from the beginning, immediate and continuous education for the new processes, ensuring an avenue for questions. Someone has to take the lead and make decisions, but it will take a village of knowledge to get you there, but somebody's got to make the ultimate decision. Walking through scenarios, sharing ideas, listening, learning, and preparing for the what ifs. Getting on a call and walking through a note with your physician partner or with your operations partner or with your own internal team or walking through the system workflows. Taking the time to do that at all levels can be very beneficial to all business partners. Keep asking questions. Status quo is not going to work. Challenge people. Listen to your customer. Develop custom solutions and recognize that one size does not fit everybody. There's got to be customer input, and that is our goal. That is why we are here, to support our customers, make their lives easier, and make the revenue cycle successful. So we have included our resources in this presentation as well for things that we've learned, guidance that we have referenced as well. And with that, here's our resources. And with that, that's the end of the official presentation, and we are ready for questions, Ayla.
Great. Thank you so much, Julie, for that fantastic presentation. And like Julie said, we will now begin today's question and answer session. So please submit any questions you have by typing them into the Q&A box you see on your dashboard. And we'll try to get through as many questions as we have time for today. Julie, I wanted to go ahead and jump in with one question that already came through. And this person is just wanting to know, how did you determine how to reassign your staffing?
So for our staffing, we created a list of all staff that had impacts to their productivity. So meaning due to the environment that they were in, their workload was reduced. And we looked at all of our numbers, across the physician revenue cycle, across the company as a whole. We did this, and we made a list of who those people were and what their skills were. So surprising to me is we have people with coding certifications and hands-on coding experience in other roles across the organization that could be reassigned to our team to help us during this emergency. And so we did that across the company. We had one leader within our organization. It was not me, it was somebody else, but they kept the list. It was placed in a central location, and you were able to go in and add your team members that were available. And then so for example, if I needed help, then I went and looked at the list who had coding experience. Did they have access to the system that I needed them to help us in? And then we worked together to get them reassigned to our team. And with being reassigned to our team, we had education set up that we, walked them through, training. It might take a day, half a day. We did that training with them, and then they were ready to start assisting us with our work. And it really helped us. I know from the coding team, it helped us tremendously, and I know throughout the organization, it was a big help.
Thank you so much, Julie, for walking us through that process. I'm looking at the questions that are coming through, and I'll go ahead and move on to the next one here. And this person is just wanting to know, in providing guidance to the physician, was there an aha moment for you, or what was an aha moment, if you can describe that?
An aha moment.
Hi, Julie. It's Christine. I could take that one.
I was going to say, Christine, did you have an aha moment?
Sure. Hi, everybody. This is Christine Brush from Ensemble Health Partners. So there were a couple aha moments that we found early on, and it was reassuring our providers, our physicians and practitioners, that they can continue to do what they do every day. But with working with IT and getting their templates updated, and then just having them fill in those additional information points and data points that are needed for our telehealth services, it was of great help to the physicians and the practitioners with the assistance from their support staff. So that was one aha moment. Another one was for services that require vital signs. So how am I going to get my vital signs for my patients because they're not in the office? And because technology has afforded us a lot of different biometric devices, patients have that ability to record their own blood pressure and their pulse and their weight, height, and temps that can be provided to the provider over the phone or through the audio-video visits. And then the provider just has to update their documentation stating that the patient reported those vitals. So that was another aha moment for our practitioner partners.
Thank you so much for jumping in there, Christine. Appreciate you sharing those very those aha moments that you had. And I think that, you know, moving on to the next question, I'll just pose this to Julie or Christine or whoever wants to jump in here. This person is just wanting to know, what did your company do to boost and support morale throughout all of these changes that were described throughout the presentation?
This is Julie. So our company, the main thing they did was they talked to everybody. So our leaders got on the phone with everybody in the company, and they talked to them and answered their questions. They allowed people to submit questions, and they provided their answers, and they were transparent with their answers. We've also had some other activities, and Christine probably remembers better than me, but I mean, we've done like COVID bingo and different things. I mean, we've done some fun activities as well as a company, trying to keep everybody engaged and upbeat. We've done videos, sharing messages with everybody. So, but I think the key thing that was successful was our leadership team, our top leaders engaging with the company and allowing staff to ask questions and providing answers.
Great. Thank you so much, Julie. And I wanted to go ahead to, before the top of the hour, we've worked through most of the questions that have come through. Also, some of them are, Christine is reaching out to some of the attendees personally to provide responses. So before we wrap things up, I just wanted to ask you, Julie, and also Christine, if you just had any final thoughts to share or any other advice for the attendees today before we close out the webinar.
Well, I'll ask Christine, do you have any words or advice?
The one thing that that I've come accustomed to that's helped me with working with Ensemble and our physician partners is get comfortable being uncomfortable, right? We know that the changes are ever changing, even faster than we're used to. So the closer you can get with your uncomfortable feelings, the more empowered you'll find yourself in knowing and having that support with your teams that you're doing the right thing. And not one of us does anything alone. We truly guide ourselves as a team effort, as Julie stated before multiple times, and that's been a very big key to our success, I believe.
I think those are great words of wisdom, Christine. And I will say, team is key, and and just being open with your client and saying, I don't know, let's sit down and talk about this, and how can I support you, and coming up with the answers, because during this we didn't have the background experience, and we had to work together to come up with the answers. And
Thank you both so much. Yes. Thank you so much, Julie and Christine. I think it's just a really great advice for everyone, and just that message of coming together as a team and working together here. I want to once again thank you, Julie, for your excellent presentation today, and want to thank Ensemble Health Partners for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having everyone join us for future webinars.
Thank you.